Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Thursday, March 11th, and this is our COVID briefing. We've had 8,363 cumulative positive cases in Missoula County to date, with 28 new cases since yesterday. I also want to let you know that on Tuesday we had 36 new cases, so we're definitely seeing an increase, and it's actually significantly higher daily numbers the last couple of days than what we've seen since the first week of February. At this point, we have had 84 deaths associated with COVID-19 to date, and we currently have 145 active COVID-19 cases, and our average incidence per 100,000 people is now up to 16. The state of Montana is reporting 101,424 cumulative COVID cases, which is up 190 new cases since yesterday. There are now 1,094 active cases with 56 hospitalizations across the state, and there have been 1,391 deaths related to COVID-19 statewide. The University of Montana has had 676 cumulative associated cases since the beginning of fall semester back in August, with no new cases reported since yesterday, and there are currently 7 active associated cases. To date, there have been 36,530 doses of COVID vaccine administered in Missoula County, with 14,329 people having received both the first and second dose of vaccine. So when we subtract the number of kids that are under 16 in our county, because the vaccine is only approved for those 16 and over, that means that approximately 14% of our eligible population is fully vaccinated at this time. Today, I'm going to talk about moving forward into phase 1B+, vaccine hesitancy, and asymptomatic testing for people who are in certain occupations. So we've been vaccinating those who fit in the 1B criteria for the past week, and today we were able to open up vaccinations to people who fall into the 1B+. Just a reminder that when we move through these phases, anyone who fits into one of the previous phases can also get vaccinated if they haven't yet. Phase 1B+ includes anyone aged 60 and older and people aged 16 to 59 with the following conditions: moderate to severe asthma, cerebrovascular disease, cystic fibrosis, those who have an immune-compromised state from blood or bone marrow transplant, immune deficiencies, HIV, use of corticosteroids, or other immune-weakening medicines, people with neurological conditions such as dementia, liver disease, pulmonary fibrosis, and thalassemia. Please check covid19.missoula.co for information about where you might be able to get a vaccination appointment. And if you need assistance in scheduling a vaccination appointment, call 258-INFO and then select option number 3. So next I want to talk a little bit about vaccine hesitancy. We understand that some people may be skeptical or concerned about the COVID vaccine. At this point, 1 in 4 American adults have gotten the vaccine nationwide, according to the CDC, and by and large, the vaccines are working. There are a lot of good reasons to go ahead and get vaccinated when we're in a phase that makes you eligible for the vaccine. Taking the vaccine is the safest way to build immunity against COVID-19 because you don't know how your body will react to COVID-19, and we still don't know many long-term effects concerning COVID-19. The vaccine is not yet approved for children, so parents are encouraged to get the vaccine to help limit their children's exposure to COVID-19. Getting vaccinated will help us return to normal. If we see high uptake of the vaccine, that will be our best shot for eliminating the COVID measures that people are sick of, like social distancing and masks. Imagine a day when we can all stop wearing masks and have big group gatherings again. That day is coming, but only if we do what needs to be done today to keep ourselves, our family, and our communities and our country healthy and safe. Getting vaccinated is one of the best ways to get the economy going again also. America's leading health experts all agree that the current approved vaccines are safe. I've heard that a lot of people are worried about the safety of the vaccine because production was sped up. So I just want to let you know that while production was sped up, this had no impact on the safety of the vaccine. The trials to determine safety were not rushed, but the reviews of the data from these trials were given priority, which really helped to speed up that process. If you're concerned about side effects, we hear you. The likelihood of a severe side effect is less than 0.5%. When mild side effects occur, they're a normal sign that your body is building protection to the virus, and most go away within a few days. So again, I would just like to encourage you to get vaccinated. And if you're looking for more information about the available vaccines, please utilize reliable sources. We have a lot of vaccine information on our website at missoulainfo.com. You can call 258-INFO and someone there can help to answer any questions that you have about the vaccine. And the CDC's website also has a lot of really great information. Last, I just want to let you know that we've now opened up asymptomatic testing for COVID at our Flynn Lane facility for people who work in certain occupations. Those occupations are teachers, staff, and faculty in schools, and daycare providers, healthcare workers and first responders, staff of congregate settings, people who work in transportation, such as city bus drivers and school bus drivers, people who work in the service industry, like grocery stores, bars and restaurants, fitness and gyms, government offices with direct contact with the public, such as courts, detention center, and the post office, and people who work in the personal care industry. So if you fit into any of those categories and you would like to get tested, please call 258-INFO and they can schedule a test for you. So that's all I have for today. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click that notification bell so that you get notified when additional videos are uploaded. You can check out our website at missoulainfo.com. You can call 258-INFO for any questions that you have related to COVID-19 or related to the vaccination. You can also follow us on Facebook at the Missoula City County Health Department's Facebook page. So until next week, everybody, stay healthy.